Hello everyone. Today we will be discussing about celiac disease. What is celiac disease? Celiac disease is gluten sensitive enteropathy. As the name says, it is enteropathy, that is injury to the small intestine due to ingestion of gluten containing foods like wheat, barley, rye. Slowly there will be atrophy of the villi of the small intestine. What are the symptoms? Symptoms start around the time of weaning, when babies are introduced to new foods. There can be intestinal or extra-intestinal symptoms. Intestinal symptoms are diarrhea, constipation, abdominal distension and bloating, and chronic abdominal pain can be there. There can be extra-intestinal symptoms like short stature, poor weight gain, delayed puberty, arthralgias and osteopenia, ataxia, and dental enamel defects. Why these extra-intestinal symptoms are happening? Because it is basically a malabsorption syndrome. There can be skin manifestations like dermatitis herpetiformis and erythema nodosa. Dermatitis herpetiformis happens in the extensor aspect of limbs, like as it appears like small papules. So when you suspect a patient with celiac disease, what investigation you will do? First of all, you have to do total IgA, total immunoglobulin A, and then IgA TTG, tissue transglutaminase. If IgA TTG is more than 10 times the upper limit of the normal value, you have to send IgA EMA, IgA endomysial antibody. If that is also positive, celiac disease is confirmed. But when you suspect a patient is having celiac and when you do IgA TTG, it is not that much high, not more than 10 times upper limit of normal. You have to refer to gastroenterologist and the next step will be biopsy. Why are we doing total IgA also in the beginning? Because IgA deficiency is very common in the community. If IgA is deficient, the total level of IgA is less in a person, you cannot use IgA TTG for the diagnosis. You have to use IgG TTG. What are the other investigations you have to do in a patient with celiac? You have to do complete blood count. You have to check calcium, phosphate, liver function test, vitamin D and iron. And what is the treatment? Treatment is complete gluten-free diet. There is no drug for celiac. They have to adhere to the gluten-free diet. You have to teach patients how to read the food labels. And what are the safe foods? Foods that are usually safe are rice, tapioca, soy.